we from the minority in Parliament were trying to bring an issue up concerning the Agenda 111 and then the AFARI hospital project. This is a hospital that is not in use, though it is supposed to be about 98% completed from our time that we handed over in 2024. And then you have Konfanochi Teaching Hospital being next door, which is overburdened by a medical attendances amongst others. So from the minority and largely the Ghanaian populace, those in the Ashanti region, questions were brought to bear why the AFARI hospital is not being operationalized. And so we needed to bring the issues to the table and let Ghanaians understand that every legitimate payment that should go for the AFARI hospital to be operationalized has been done. And the question that had been coming up was, if it was left with only 500,000, why have it not been operationalized? And that is a question that the Minister for Health should be telling us as a people. And yet we were given indication that there's an additional request for 85 million by the contractor to complete it. And this was what we found very scandalous, because you see, when a contract is awarded and payments are made over a period of time, you cannot, by a change of government, hear certain figures being thrown out there when those figures makes no sense. So we were pushing the Minister for Health to come and explain where this figure of $85 million was coming from, when clearly the hospital is completed by and large at 98%, and it needed operationalization. This is not the only hospital that is almost completed that needs operationalization. Wager Hospital, Jerry made mention of it on the floor of the House. I have engaged a contractor who says that everything is set.
But I think with the wager, we saw the statement coming through which suggested that the contractor had inflated the contract up to 11 times the amount, and it was resulting in challenges from the World Bank. We saw the letters from the World Bank as well stating that it's the reason why they've not been able to proceed. But the health minister said they were working to have all of the challenges addressed with respect to wager.
Yeah. So you see, this is why I have a problem. When you have a hospital of that magnitude funded by World Bank, and we have a Ministry of Health which is supposed to engage and make sure that it becomes operationalized, we cannot be sitting for 1.5 years and say that we are still discussing the issues. What is it about these matters that we cannot sit at table within weeks and resolve?